Hi, Jean. Good to see you back. How do things go?
Well, doctor, I feel pretty good, actually. I've been seeing you for about 5 months, and I'm really down to about maybe 20 cigarettes, which is only one small pack.
Right.
I have made a decision. I decided that I am going to quit smoking in 1 month.
You're kidding me.
30 days.
Wow.
And I'm so excited to tell you that. Things have been going quite well for me.
Great. Excellent. Now tell me, again, the last time you were here, you said your confidence was about the 35 to 40% point. Where would you rate it now, today?
Well, I feel very confident. I would say probably 80%.
8. Okay.
I feel really good about
So
things.
8 out of 10.
Yes.
That's amazing.
8
Okay.
out of 10.
Yeah. So what would you have to do to prepare for that date where you actually say, okay, that's it, no more cigarettes?
Well, I have the backup of my friends and family.
Right.
I don't smoke in the car anymore. I don't
Excellent.
smoke in my house. I had everything cleaned.
Sure.
I don't go out at work for breaks with everybody. Maybe once a day
Right.
I allow myself.
So now that you're talking about getting ready for a quit plan, one of the things that helps people is to think about it in sort of 3 terms. One is obviously things that you can change in the environment. So you've talked about maybe smoking outside, not smoking in your vehicle, those kinds of things, avoiding the people who make you smoke, those kinds of things. So it sounds like you've got that pretty much under control. As well as behaviorally, which is the second part of it, you've committed to saying that you've been trying to delay and distract yourself when you have the urge, and you've been trying to resist it. But the other option that also works well with those 3 is medications. What are your thoughts about medications to quit smoking?
I was thinking maybe we could discuss that again because I still need some help.
Sure. So it sounds like you're open to exploring medications to quit smoking, and there are quite a few options out there right now. So first is the nicotine replacement options. Those are all available over the counter. You have the long-acting nicotine replacement, which lasts for for 24 hours, and that's the patch. And then you have the shorter-acting preparations, such as the gum, the inhaler, and the lozenge. So you have those options as nicotine replacement. Ideally, they're used alone, but in some cases and in some people, especially if you smoke more than a pack a day, you sometimes need to combine the 2. The other options are prescription options. There's a medication called bupropion, or its commercial name is Zyban. It's sometimes also known as Wellbutrin. And what that does is, it's an old antidepressant, but what it does is it cuts the cravings to smoke. And it works in about 1 in 10 smokers to help them. The third option is a new medication on the market, which fights for the place where nicotine actually acts in the brain. And what it does is it blocks the cravings, but at the same time keeps you out of withdrawal. And that's another tablet. That's a new medication that's on the market. So broadly, these are the medications that are out there. What are your thoughts about the use of medications?
Well, I've tried the nicotine patch. I've tried the gum,
Right.
which is an ugly habit. I hate chomping away like that.
Okay.
Tried them. They didn't work for me anyway. You
Sure.
mentioned, I think you mentioned a couple of medications.
Right.
I really like the idea of the 3rd medication, which is new on the market.
Oh, you want that. That's called Varenicline or Champix. And if I were going to write you this prescription, is there anybody you could tell?
Oh yes, I'd tell my family.
You tell your family.
Yes.
Because what I'd want them to do is to know you're on the pill, and if they observe that your behavior is changing in any way, that you're too irritable, or you're too depressed, or you're talking about suicide, that they actually, you stop the medication and you come in.
Okay.
Now that doesn't happen very often. The more common side effect that might happen is clearly that some people get more nausea with it, and they may have some abnormal dreams. But that can be easily managed with a reduction in the dose.
So
And- And then with any medication, if you have an allergic reaction, you have to stop it right away.
Okay.
So the way this medication works is you actually start it 1 to 2 weeks before you actually try to stop smoking, so that the levels can be built up in your body.
I see.
And so you start off, and it's a gradual. So you start off with 1 pill once a day for 3 days, and then on the 4th day you go to 1 pill twice a day, and then after the 7th day it actually bumps up to a higher dose.
With all these things in place, I feel much more confident.
So just to summarize what we've talked about today, you're really ready to quit in the next 30 days. You've got a date in mind where you're going to stop. What I'd like to do is I'll write you a prescription for this medication, Varenicline, and I'd like you to start it as soon as you get it filled. And then about 2 weeks from now on your quit date, you stop. Of course, if you have any side effects before then, I need to see you sooner. But otherwise, if you want to quit and come in and check in with me in those first 2 weeks after you've quit.
Okay, that would be great. I'd appreciate that.
Okay, and you know what? If it's not working out, there's always other options. So I'd love you to come back and talk about it, even if you feel the medication isn't working, because sometimes it can take even up to 4 weeks before it works.
Okay, so I'll keep in touch with you?
Yes, please.
Excellent, thank you.
All right, very good. Thank you.